Good afternoon, and thank you for everyone for coming. My name's Chuck Kiesling. I'm the Lycoming County Coroner, and it's kind of an interesting position for me to be in, speaking about infant safe sleep, but it's something that's become very near and dear to my heart. It's been a passion, along with many of the folks that are here today, to speak to you about infant safe sleep. But for the last 30 years, I've been a registered nurse and also the Lycoming County Coroner since January of 2000. And over the years, we've seen infant deaths while co-sleeping on a far too regular basis. And in 2001, I started the County Child Death Review team, and we kept looking at these deaths, reviewing them, and talking about what can we do to prevent these deaths from reoccurring. And out of that, we started to develop a plan, starting to talk to folks locally as well as nationally on infant safe sleep. And from that, we moved forward in 2008. The Cribs for Kids program was established out of the Lycoming County Coroner's Office. And with the Cribs for Kids program, we're able to provide pack-and-play cribs for needy families. We've also we're able to get the OB nurses at Williamsport Hospital, we have a couple of those folks here today, to work with us in developing education and identifying families at risk for co-sleeping type situations. So the infants, when they leave the hospital setting from Susquehanna Health, we know they're going home to a safe sleep environment because we'll provide them with the cribs. So we've continued to do that. We've distributed over 100 cribs since 2008 in the community. Thanks to the OB staff at Susquehanna Health, Social Services, the Pennsylvania Department of Health nurses, Children and Youth, Family Nurse Partnerships, and other Lycoming County Safe Kids members are out there doing the education to provide and try to prevent these infant deaths from occurring. Through everyone's efforts, we've seen a significant reduction in the number of infant deaths across the county that we've been called to investigate. We had actually gone almost 2.5 years without a co-sleeping infant death in Lycoming County. So prior to that, we were seeing 1 or 2 usually about every year. So along with our efforts, Representative Garth Everett, who's a friend of mine and has been serving the residents of Lycoming County since 2006. He's been my sounding board for anything and everything when it comes to legislation that we can do to try and prevent injuries and deaths throughout Lycoming County. So Representative Everett, we had discussions, and out of that, in 2010, Representative Everett submitted the first resolution naming Infant Safe Sleep Month for the month of November. And he's continued to do that graciously every year now since 2010. So we're now in our 5th year. The program continues to raise awareness not only in Lycoming County, but across the Commonwealth of Pennsylvania. And through that, we're seeing the improved death rates is decreasing throughout the Commonwealth as well as across the country. So Representative Everett, there he is.
Thank you, Chuck. And Chuck is actually a little too kind there. He's actually the one that I bounce issues off of when it has to do with nursing, EMT things. He's a flight nurse, coroner. So when those kind of issues come up on our legislative agenda, or I see somebody introduce a bill, I'm the one that bounces them off Chuck, and he's the driving force behind the infants safe sleep issue, which is a tongue tire in itself. And I want to thank Chuck and the folks that are here today and are going to speak. Their expertise in these matters is very important, and these are all preventable deaths, and that's the thing that makes it so very important. These are all things, and the death rates are going down, and that's a wonderful thing. And I'm more than happy to be involved in the process. It's a lot of it is about publicity and about getting the word out to folks. It's not that complicated, as will be explained today. So I'm proud to be part of the process, and thank Chuck for his efforts and those of everybody else. And I'll just very quickly read the resolution. Whereas the children of Pennsylvania are our most important resource and the very foundation of the future of the Commonwealth, whereas thousands of infants in the United States die each year in preventable tragedies because they are placed in unsafe sleeping environments. Whereas in April 1992, the American Academy of Pediatrics Task Force on Infant Sleep Position recommended that infants be placed on their backs to sleep. Whereas the safest sleeping environment for babies is alone on their backs in an empty crib with a tightly fitted sheet and sufficient sleepwear. Whereas the National Institute of Child Health and Human Development's website provides parents, grandparents, relatives, and daycare providers access to resources containing information about providing babies with safe sleep environments. Whereas the month of November is an opportunity to inform and remind all caregivers to check infant sleep environments to help prevent needless tragedies. Therefore, be it resolved that House Representatives designate the month of November as Infant Safe Sleep Month in Pennsylvania. And this was passed unanimously in the House of Representatives on October 15th. And I'm, again, privileged to be part of this. When I remember the crib that the antique crib that I refinished for our children, it met none of these parameters, and I'm happy that they survived a non-safe sleep environment somehow. They must have been pretty rugged, or we just got lucky. But this is the way to do it, and I'm proud to be part of it, and thank you.
Our next presenter will be excuse me, Dr. Carrie DeLone. She's the Physician General for the Commonwealth of Pennsylvania since July of 2013. Her role is to advise the Governor and the Secretary of Health on health matters and policy. Dr. DeLone has been a voice in injury prevention, promotion of healthy lifestyles, and supported by the Pennsylvania Department of Health. Dr. DeLone is board certified in internal medicine since 1985 and has clinical experience in both urban and rural settings across the Commonwealth. I first met Dr. DeLone last year when she made the trip up north to Lycoming County and Williamsport to present the resolution last year at the newly moved into Williamsport Hospital on the Susquehanna Health campus. So, Dr. DeLone.
Good morning, and I'd like to thank Chuck and Representative Everett for all of their efforts for safe sleep. And thank you to Representative Everett for hosting today and for inviting me to speak again this year. And it isn't snowing today. Last year when we drove to Williamsport, it was, and tomorrow it's going to snow, so I have lots of great memories. But we really are here to promote infant safe sleep education and awareness because this campaign will save the lives of babies. The primary goal of the Department of Health is to improve the health and safety of all of our citizens. And one of our most vulnerable citizens are our babies. Each year in the United States, approximately 4,000 children die of sudden, unexpected infant deaths. And more than half of these are classified as SIDS, but we now know that many of these sudden, unexpected infant deaths are preventable by putting babies in safe sleeping environments. In fact, back in 1992, the American Academy of Pediatrics made their recommendations that babies should sleep on their backs because this was the safest way for them to sleep. 2 years later, the National Institute of Child Health and Human Development began their Back to Sleep campaign. And through these two organizations and a lot of advocacy, there was growing public awareness and successful interventions that dropped our rate of sudden unexpected infant deaths significantly. In fact, according to the sleep data, back in 1992, 13% of babies were put on their backs. By 2006, 76% were put on their backs to sleep. And during that time, the CDC data showed that the SIDS death rate decreased by 20%. So what does this information tell us? It tells us that creating awareness and providing education works, and it's crucial. But what we've also learned is just putting babies on their backs is not enough. They need to sleep alone, not with their parents or with their siblings. They need to be on a firm mattress with a well-fitted sheet, and they shouldn't have items in their cribs that can compromise safe sleep. In December of 2010, Act 73, the Sudden Infant Death Syndrome Education and Prevention Program, went into effect. And the result of this was that the Department of Health began a statewide SIDS initiative with the goal of providing education to new parents about the risk of SIDS and give information on safe sleep practices. So this program supports a statewide collaboration of education and awareness among caregivers and healthcare workers, new parents, relatives. It promotes also sleep ambassadors, and these are staff members of hospitals who model safe sleep at the hospital and also teach new parents about safe sleep. This act also grants opportunities, gives money for new Cribs for Kids chapters throughout the Commonwealth. We collect data to look and analyze what's going on so that we can use evidence-based programming accordingly. But we also know that we really need to connect with those that are at highest risk of failing to practice safe sleep habits. So by working together, and we have the state, we have the Hospital Association of Pennsylvania, we have the American Academy of Pediatrics, and of course we have the leadership of Representative Everett to do this. So our babies are depending on us to show them the way to lead healthy, happy, and productive lives, and the first step in ensuring their safety is to make sure that they have a safe sleep environment. So thank you very much, and with that I would like, turn it back over to Chuck.
Our next presenter comes to us from the Hospital Association of Pennsylvania. Effective July 1st, 2014, Dr. Michael Consuelos was appointed Senior Vice President, Clinical Integration for the Hospital and Health System Association of Pennsylvania. Prior to his appointment, Dr. Consuelos served as Vice Chair of the Pediatrics Department since 2003 at Lehigh Valley Hospital Network. Dr. Consuelos was joined our efforts in continuing to raise awareness of infant safe sleep in hospitals across the Commonwealth. Dr. Consuelos.
Thank you, Chuck, and once again, thank you, Representative Everett, for your efforts to advocate for this very, very important topic. So, as was mentioned, I'm a general pediatrician, and as an advocate for this, I am honored really to be here amongst friends and advocates for a safe sleep environment for our children in Pennsylvania. I won't go through all the details that I've already described, but I think you understand the impact of this effort. And as was said, this started back in 1992, and in the mid-90s, about 3 years later, I was working in an emergency department in Philadelphia, and I probably had one of the most sad moments of my professional career going to the emergency department early in the morning when a parent found their infant dead in their crib. And even to this day, I am emotionally touched by that experience and talking to the parents about what happened. So this really happens, and this affects obviously the family, but others around them. And as a healthcare professional, this is our worst nightmare, and that is to see an infant die from a completely preventable process that really just all it takes is education and this very simple apparatus that you have right up here. So with that being said, I think this is an important effort, and as the representative from the Hospital and Health System Association of Pennsylvania, I'm here to say that we support this effort. We are going to be working with these advocates to encourage our hospital members to take this initiative forward, to reinforce this initiative, and to prevent further deaths to our infants. Hospital leaders and physicians and nurses are really educators. Yes, we stamp out disease, but really one of our prime efforts is to talk to our patients and our patient families. And this, again, is really an educational effort. It does take some resources, but the biggest resource it takes is time. And in that time that we have with expecting mothers and fathers, and again in well baby nurseries, that time is the most important time to affect change in their future lives. We need to make babies safe as possible in their sleeping environment, and we need to eliminate as many of these preventable deaths as possible. I think we're building momentum, and year after year, as you heard, these deaths are decreasing. And again, I want to thank the friends and advocates that I have around me in this effort, because undoubtedly there are children today in kindergarten, at school today, that wouldn't be there because if the parents hadn't received this education and proper, safe sleep environment. Thank you.
Okay. Our final presenter for the program today is Dr. Michael Goodstein. Dr. Goodstein is board-certified neonatologist from York, Pennsylvania. He established the York County Cribs for Kids program and has served as their director since 2003. He's a board member of the National Cribs for Kids program, and has established the Safe Sleep Initiatives in 2008. Over the past several years, I've had the pleasure to travel across the Commonwealth, Pennsylvania, with Dr. Goodstein, providing education to nurses, physicians, coroners, police officers, and other healthcare workers about infant-safe sleep practices and best practices regarding the investigation of infant deaths. Dr. Goodstein.
All right, thank you, Chuck. First, I want to thank Representative Everett for his unwavering support for infant sleep safety in Pennsylvania. I also want to thank Dr. DeLone and the Department of Health, as well as Dr. Consuelos and the Hospital Association of Pennsylvania for their ongoing work to promote infant sleep safety. Before I offer our concluding thoughts today, I want to share a brief but really powerful video discussing current infant sleep safety recommendation. What I think you'll find striking about this video is the three brave women who share their stories of loss in the hope that others will not have to share the tragedy of an infant sleep-related death.
I'm Ayana Williams. I have one daughter. She's 12 years old, and I had a younger son. He would have been 11 months old. His name is Brandon Lawson.
My name is De'Ara, and I live in the northern part of Baltimore. I have a husband, 3 children. A 4-year-old, his name is Eugene. I have a 1-year-old, her name is Sanaya. And I had a baby boy, his name was Charlie.
My name is Lottie Plumley. My son was born in Baltimore, Maryland on November 12, 2009. My son's name was William Woodward.
I basically got a phone call from another family member that was living in the house that the ambulance was at the home trying to resuscitate the baby and that they were rushing him to Hopkins. He was not in his crib, he was in the bed, in our bed.
When I woke up at 4:30, he was gone. We had found him dead in the middle of our bed.
On December 29th, Charlie passed away. He turned a month that day. That morning, he was in the bed with us. And when I woke up and looked over at him, he just wasn't breathing. If I had a chance to go back to December 29th, knowing what I know now, I probably would have changed a lot of things.
I have a 7-month-old baby, and I learned when I went to his doctor for his first appointment that all the babies need to sleep safe. That means alone, no parents, no brothers or sisters, on his back, not on his tummy, and in the crib. That means that in the crib they don't need any bumpers or pillows or blankets, any teddy bears, no exceptions.
For you to be asleep with a baby, I don't think that's a good idea. I don't think it's worth the child's life. Research shows that babies who sleep with a parent are 3 times more likely to die than babies who sleep alone in a crib. Every month, an average of 2 babies less than a year old die in Baltimore City. These are preventable deaths.
I'm Dr. Everett, Melissa Houston. I'm a pediatrician working for the Baltimore City Health Department, and I'm a mother of twins. It is so important that babies are put to sleep alone, on their back, and in a crib. When we go to sleep at night, we toss, we turn, and the little babies are not strong enough to kick back and say, I'm still here, don't roll on me. And so that's how a lot of infants end up dying.
You could possibly roll over the baby, your arm, or the brother and sisters could, put their arms in the windpipe and could suffocate, or the baby could possibly roll over to the side and not be able to get any air.
Since doctors have started telling moms to put their babies on their backs, 50% fewer babies have died due to SIDS.
When you sleep on your stomach, your windpipe is down, and that's where gravity flows. So if my baby were to spit up while they were sleeping on their stomach, it's a sure path down through the windpipe or the trachea into their lungs, and I knew I didn't want that to happen.
A safe crib should have absolutely nothing in it but the sheet, a mattress, and absolutely nothing else. No blankets, no bumpers, no bears, no toys, nothing but the baby, the sheet, and the mattress.
If you needed a crib, Baltimore City will give you a crib.
It's okay to share the room with your baby, but not your bed.
Well, it's very important to all the babies to sleep safe, and even if you say it won't happen to me or doesn't happen to all the babies, you never know, so sleep safe, alone, back, crib, and no exceptions.
I know a lot of times older people do things the way they did it when they were, raising their children. And, you just sometimes kind of have to let them know, this is how I want my baby to sleep, or, this is where I want him to sleep, this is what I prefer for him or her. It's your baby. You have to let them know what you want for your baby. At the end, it's if something was to happen, you have to live with it, not them. You can never replace that child that you lost, ever. And you'll never, ever forget it. Something you have to live with every single day, to wake up and your arms be empty, or, your home is missing a child, or, you'll never be able to have grandchildren from that one child. Or it's something you can never change it.
I never expected this to happen. I don't think any mother really does. I haven't really hit the big milestones yet, like his birthday, which is coming up, the year anniversary.
I finally went to go visit Charlie's grave for the first time yesterday. Having to look in the ground for something that symbolizes where my son is, where his body is. That was hard in itself, and then finally finding it and seeing his name on this headstone, my son. It was so hard.
I would tell other mothers just to really really do what everybody says, because I really, really, really don't want this to happen to anybody else.
It's something no one should ever have to experience because it's the hardest thing to get through. I really miss Charlie, and I'll always love him with all of my heart. My love will never change for Charlie because he's my baby. I really, really love my son.
All right, so how big of a problem is this? Sleep-related deaths are the third leading cause of infant death in this country. After 1 month of age, it is the leading cause of death. 3,500 babies die in this country every year, suddenly and unexpectedly, sleep-related. If you do the math on this, that is one baby dying every 2 to 3 hours of every day of the year. This is a silent epidemic in this country, and we're here to break that silence today. By studying these deaths, we have learned the importance of a sleep environment for making our babies safer. Through a safe sleep environment, we find that with Back to Sleep, we've reduced the number of deaths by 50% related to SIDS. When we look at these deaths and do death scene investigation, which is so important, we find that 90% of the time there was a risk factor in the environment that played a role in the baby's death. We look at suffocation deaths and we see that they're up 30% in the last decade. Everybody wants to be the best parent and grandparent they can be. In order to make good decisions for your baby, you need to know the medical evidence to make good decisions. So remember your ABCs. Baby should sleep alone, on the back, in the crib, no exceptions. Parents sometimes are afraid to put their baby on the back. As you saw in the video, there's this fear of choking, but when the babies lay on the back, the airway is protected because it's higher up than the esophagus. So we don't need to fear that. And again, the Back to Sleep campaign has been one of the great public health success stories of the late 20th century. We estimate about 35,000 children and adults alive today because they were put on their back to sleep by their parents. So we should use a crib, a bassinet, a pack and play, a play yard, a firm surface that's approved for infant use. No soft objects, no bumpers, no loose objects, no head coverings, and we don't want to overheat the baby. We want you to keep your baby close to you, room sharing, but not bed sharing. We find that when babies share the bed, there's a 5 to 10-fold increased risk of them dying if they're under 3 months, and those are babies where the parents are not impaired, they're not drunk, they're not on drugs. It's just a separate risk factor for infant death. We want to promote breastfeeding. That is key. Babies who are breastfed are 50% less likely to die of SIDS. And no smoking in the environment. And not just the environment for secondhand smoke, but during pregnancy. If women didn't smoke while they were pregnant, about a third of SIDS cases would just disappear. You might wonder how we are doing. The Pennsylvania Child Death Review Report for 2014 just came out last month with the 2011 data. It's the most recent data we have. And infant mortality rates are down from 7.3 deaths per 1,000 live births down to 6.5. However, that's still 81 deaths in our state. 2/3 of those babies were not sleeping in a crib. 58% of them were sharing a bed. And we still see a racial disparity, almost 3 to 1 African American babies more likely to die than Caucasian babies. Those 81 deaths represent 4 kindergarten classrooms that are silent forever. Parents should visit their baby at the schoolyard and not have to go to the graveyard. No parent wants to think that this could happen to their child, but last year there were 3,500 families thinking the exact same thing, but they lost their baby. Mahatma Gandhi said, "A nation's greatness is measured by how it treats its weakest members." Coordinated efforts at the state and city levels are leading to saved lives. In South Carolina, the Department of Health recently reported a 41% drop in accidental sleep-related deaths. This Baltimore campaign, Be More for Healthy Babies, in 2012, they had their lowest infant mortality rate ever recorded in Baltimore City, decreasing 28%. And the racial disparity in these deaths decreased by almost 40%. The biggest contributor was a decrease in the number of sleep-related deaths. In Pennsylvania, there are ongoing efforts through the Department of Health, the Hospital Association of Pennsylvania, the Pennsylvania chapter of the AAP to provide education to providers, families, and the public on infant sleep safety. And we are looking to expand these efforts with other healthcare and safety groups across the state for consistent messages promoting the health of our babies. In concluding, I again want to thank Representative Everett, Dr. DeLone from the Department of Health, the Pennsylvania chapter of the AAP, the Hospital Association of Pennsylvania, and Cribs for Kids for taking the time to focus on the issue of infant sleep safety, and for how we as a community can come together to make every sleep environment a safe one for our babies. November is the perfect time for Infant Sleep Safety Month. This is a time of giving thanks. There's no greater gift than our children, and their good health is a blessing. And we should never take that for granted. So remember your ABCs, alone, on the back, in the crib. For more information, you can go on the web to www.healthychildren.org or www.cribsforkids.org. Thank you so much, and I think we'll have some time for some questions for any of our panelists. Thank you. Great, thanks everyone for attending today. Appreciate it.